Okay, now we're doing this chapter from John Mcdougall, The Doctor Who Fought for You, Chapter 5. We're doing Mcdougall's Mentors. We're going to start with Dennis Burkitt. Yeah, this is a book I wrote about Dr. Mcdougall, summarizing his work. Okay, so Dennis Burkitt was his first major mentor, and Burkitt was the first one who got him to realize that food and diet were related. And I know what he's talking about because you never learn about the importance of food in med school. They always act like diet's irrelevant. It's a big joke. And then later on, they'll tell you the Mediterranean diet's the way to go, which is obvious nonsense. So anyways, here's Dennis Burkitt. He lived from 1911 to 1993. His nickname was the Fiber Man. He was born in Ireland. Did some of his training in England, so he had a lot of experience with the Western diseases working as a surgeon. And then he went to Africa as a Christian missionary. And he was in Uganda for about 17 years. And while he was there, the local population ate a plant-based diet, and he almost never saw the typical Western abdominal diseases, except, when somebody was coming from the West. By the way, Dr. Mcdougall is Irish. I think he's Scots-Irish. The guy named Dr. John Kelly, who wrote Stop Feeding Your Cancer, a book about, kind of going by Caldwell, actually T. Colin Campbell's book, China Study. He put a whole bunch of patients on a vegan diet and got quite good results. He's another Irish doctor. I'm half Irish. My father's from Ireland. My mother's from Puerto Rico. T. Colin Campbell, I think he's Irish or Scottish or English, something like that, because in one of his books he talks about going back to that area and all that stuff. Kelly Turner, she certainly looks Irish. Her real hair color is red, fiery red. Michael Brownlee is sort of an Irish-Scottish name. He's the guy who wrote the best paper ever written on diabetes. Durian Riders from Australia. And they used to send the prisoners, like the Irish prisoners and some of the other prisoners from the Britain area, to Australia. And Durian Ryder seems like he might be descendant of prisoners. Now, I'm just kind of kidding. I like Durian. He's funny. Okay, Jeff Nelson, I think, is Scottish. So anyways, be that as it may, there's a lot of Irish, Scottish. Irish and Scottish are almost the same thing in Welsh. It's all kinds of go to. They're all oppressed Celtic peoples related to England. All right, so anyways, Dennis Burkitt's a genius. He figured out abdominal pressure syndrome, and he lectured about that traveling around the USA. Fiber only comes from plants. There's always fiber in plants because the cell wall of an individual cell is made out of fiber. And there's never any fiber in animal foods. So that's why, that's another reason why plant foods are better. Processed foods tend to have very little fiber. It attracts water to the stool, which is good. So your stool is kind of liquid. By being liquid on the right side, it doesn't plug up the appendix, so they almost never get appendicitis. By being liquid and kind of bulky, it stretches the rectum when it reaches down to the rectal area. And that stretch of the rectum causes a reflex contraction. So when you defecate, it just comes out easily. And you get a nice cow patty in the bowl. Okay, that's how you're supposed to defecate. What happens to a constipated person, somebody who eats meat and processed food in excess, there's a lack of fiber, so it doesn't pull water into the stool. The stool's dry. Because it's dry, it can occlude the appendix on the right side. Dry stool on the right side cause appendicitis. Then it goes down into the rectum, and you're talking about goat pellets or hard Tootsie Rolls, if you will. And because they don't stretch the rectal wall, in order to empty completely, the person has to strain their abdominal muscles. That's called the Valsalva maneuver. And the Valsalva maneuver creates increased pressure in the abdomen. I'll show you a picture of it in just a moment, but it causes back pressure, pushes the upper stomach into the chest. So you get a hiatal hernia, that's called. Average Americans only eating about 5 to 10 grams of fiber per day. We really should be eating about 50 or more. Burkitt says we're sort of designed, our ancestors ate 100 or more per day. So, all right, when you don't eat enough fiber, you end up with abdominal pressure syndrome. It's normal to have about 1 to 3 bowel movements per day. It can be normal to have only 1 bowel movement per day, and sometimes you might miss a day, but in general, 1 to 3 a day would be pretty typical. When you're on a work day, you're more stressed out. You're more sympathetic autonomic nervous system, so you're going to have less bowel movements than you have the day off and you're relaxed. You'll be more of a parasympathetic autonomic nervous system, PANS. PANS is rest and digest, feed and breathe. SANS is fight or flight. SANS is the accelerator, PANS is the brake. Okay, of the autonomic nervous system. Okay, a fecal lift, also called an appendical lift. Lift means stone. It'll, again, obstruct, let's say here's your appendix hanging down from your cecum. It'll obstruct it at its origin, and then the mucus glands below keep secreting mucus, and so they can't get past the obstructing stone, so it pops. That's appendicitis. Okay, let's see here. Yeah, it'll be best to just show you the picture. Oh, Dennis Burkitt said, America is a constipated nation. If you have small bowel movements, you need big hospitals. If you have big bowel movements, then you only need small hospitals. Okay, so here's abdominal pressure syndrome. Straining at the stool, Valsalva maneuver, you get rectal hemorrhoids. And those can bleed. They can be a little uncomfortable, the external ones. You get back pressure down into the scrotum, and dilated veins in the scrotum will heat up the testicles. That's a varicocele, that's called. That can cause infertility. So yes, constipation can make a guy infertile. You get back pressure down into the leg veins, and that back pressure down into the leg veins can cause a varicose vein in the legs. Back pressure through the rectum into the sigmoid colon, that's the part that connects to the rectum. It'll cause outpouching of the wall. It's called diverticulosis. Super common in Western countries. But I've known doctors that work in countries where they eat real high fiber diets still, and they say, we don't have any diverticulosis in our country. Whereas in the USA, you'll see it in the vast majority of middle-aged and older patients. If one of those diverticuli should pop, it'll leak stool into the adjacent abdomen, the mesenteric fat, and it'll cause inflammation of it. So it's diverticulitis. Itis means inflammation, so it inflames the fat. You know, there's admissions for this. Every week you get a couple of admissions in a Western hospital. I drain tons of abscesses for this exact reason. Sometimes when it's really leaking a lot of stool, you'll have free air with a major perf, and you need to go to the operating room for a sigmoidectomy. You get a temporary diverting colostomy. It's no fun. The stomach from the back pressure will pouch into the chest, and that's called a hiatal hernia because it expands the size of the hole in the diaphragm, the diaphragmatic hiatus. And then the part of the stomach above is getting stomach acid leaking up into it, and it also tends to loosen the lower esophageal sphincter, so you'll get acid going up in the lower esophagus, and that's called a Barrett's esophagus as the mucosal lining changes, the epithelium changes, and it increases the risk of cancer. Gastroesophageal reflux disease, GERD. Okay, well, I just gave a video recently, like in the past week, about how to minimize the symptoms of GERD, like heartburn and those other discomfort. It can reflux all the way high up into the airway, cause laryngitis, hoarse voice, can cause asthma, can go up into the paranasal sinuses and cause sinusitis, so you don't want that. Same patients who get that also tend to have a high incidence of gallstones. Gallstones just tend to be precipitation of cholesterol. 95% of them about are cholesterol gallstones. So it's a high-fat diet typically that's doing this because there's no fiber in animal foods. Animal foods intrinsically are high in protein, high in fat. The classic sort of prototype is salmon, 50% protein, 50% fat. They're not good for you. There's a nice live interview with Dr. Burkitt. It's on the Dr. Mcdougall YouTube channel. And it's about the only, I think, live interview of Dr. Burkitt on the whole internet. It's very good. He's a nice old Irish guy. Okay, here's a nice book about Burkitt, my favorite Burkitt book. It's written by Ethel Nelson. She's a physician, and it's all about the life of Burkitt and how he first became famous for describing Burkitt's lymphoma, and that was real popular. That's actually in the medical books because they want you to know about that, a type of cancer potentially related to virus, malaria, and whatnot. But they don't want you to know about his abdominal pressure syndrome. That's not in any of the medical books. I never heard of it until many years after I was done with med school. And I can guarantee you today, because I still see med students occasionally, none of them knows it. I've never in my whole life met a single doctor that knows abdominal pressure. Not even the surgeons, abdominal surgeons who work on all the diseases that abdominal pressure causes, none of them knows about it in my experience. And I've talked to a lot of them, so that's why medical education is a joke. Conventional medical education is a joke. Just teaches people how to deal drugs. Okay. Dr. Mcdougall newsletter, January 2013. He goes into a lot of his experience with what he learned from Dennis Burkitt. Okay. Couple things here. Dr. Burkitt wrote, first of all, let's see, this is Dr. Mcdougall. The key to big bowel movements is increase the amount of dietary fiber. Burkitt was the first doctor who told me about the connection between food and diet. Okay, let's see, what else? They make more stool. Okay. Oh, there was essentially no type 2 diabetes in Uganda where he worked, where they ate a plant-based diet. No type 2 diabetes, no obesity, appendicitis, no diverticulitis, none of this inflammatory bowel disease, no ulcerative colitis or Crohn's disease, no dental caries, no varicose veins, no hemorrhoids, no hiatal hernia, virtually no colon cancer. I know that in Africa, before 1957, there were no described cases of rheumatoid arthritis, autoimmune disease. Dr. Burkitt only saw one case of gallstones in 20 years. He only saw one heart attack, and that was a guy who had just returned from England and was eating beef and whatnot. Dennis Burkitt said, the frying pan is something you should give to your enemy. Food should not be prepared in fat. Our bodies are adapted to a Stone Age diet of roots and vegetables. Yep, you want to eat like your ancestors, Adam and Eve, but keep your indoor heating and plumbing. Okay, Dennis Burkitt continues. Diseases can rarely be eliminated through early diagnosis or good treatment, but prevention can eliminate diseases. If people are constantly falling off a cliff, you could place ambulance under the cliff, or better yet, you could build a fence on top of the cliff. We are placing too many ambulances under the cliff. Then he says, Western doctors are like poor plumbers. They treat an overflowing faucet by trying to dry the floor. Somebody should teach them how to turn off the faucet. Sounds good. Okay, if you want to learn more about Dennis Burkitt, check out the Dr. Mcdougall interview. And then here's a paper you might like. Dennis Burkitt and the Origins of the Dietary Fiber Hypothesis by John Cummings. Okay, that's interesting stuff. So that's it for Dennis Burkitt. And we'll talk about the next mentor in the next lesson.